Okay, well, I think we will reward the punctual here. 12:01 Mountain Time in Denver, where I'm sitting. I know people are joining from all time zones, so thank you for making a little bit of time somewhere around your lunch break. Um, we are thrilled to be here in 2022. We're going to do just a little bit of housekeeping at the outset of our webinar here today. So talking about some Q&A options, talking about what we're going to go through and an agenda, then we'll do some introductions too. But really, just to get started, again, thank you for being here. From Clarity's perspective, we are oftentimes talking to all of you with a little more breathing room between open enrollment and the first time that we pop our heads back up and ask to get on the phone and start talking about the year ahead. We're doing so with really strategic purpose this year. And just as we look at our agenda, we'll talk a little bit about that. So we're going to go through a welcome to 2022. But really what we want to elevate the conversation to and why we're speaking in January is we know outside of what the many people on the phone here have always leaned on Clarity for, which is really high quality on-time delivery of healthcare correspondence. We are increasingly hearing our clients talk about, hey, we as an organization have loftier goals. And we're starting to talk about where and how is every opportunity to engage our memberships in bigger aims, maybe some marketing aims, maybe disease management aims. And we've been doing a lot of thinking at Clarity on just asking ourselves, how can we be a partner in all of our clients' journey that they're going through there? And so when we talk about making 2022 a year of engagement, what we're really going to go through today is how can we lean on the same Clarity products that we know and love, but raise their value ceiling and say, can they do more for us than just check the box on that distribution or maintain a baseline of communication? Can they start to be a mechanism that is a little more wind in the sails of your engagement goals? So we'll get into that a little bit and marry that with kind of engagement 101 and how we use correspondence to achieve that. Knowing your audience, of course, always matters in this arena. So we'll do just a quick touch on how we think differently about engagement for our Medicare, Medicaid, and commercial audiences. And then a place that we at Clarity had gone through sort of a thought exercise was, what if we were totally unencumbered by really any of the constraints that a health plan might have? What would we look at as, and that's a great way to leverage Clarity products to drive engagement with an individual member. So we're going to take you into the life of that member, show you how her calendar year sort of looks from a correspondence perspective, in the hopes that that can add a lot more value here. Again, I said there'd be some housekeeping. Slides are going to be recorded and distributed. So if you're feverishly grabbing screenshots, if you're trying to take notes, just know that that you can get your hands on these and on the recording hereafter. And I think we've got some polling. We've also got some Q&A. So if you've got questions as we go through this, we've got a little bit of time blocked for the tail end. So there's a place that you can submit your questions. We're monitoring those just off the side of the stage, and then we'll loop back to them if we haven't during the content. So one of the things I was really excited about in sort of looking at the attendee list that we've got today, which is a huge amount of people in health plans here, was the diversity of who's on the line with us and basically who had an interest in this topic. And so if I'm just quickly referencing, I saw vice presidents of member engagement. I saw customer experience journey managers. I saw clinical outreach representation. And I also saw materials management, correspondence management. When Clarity looks at that list, we could not be more excited, because I think what we're doing is helping to connect the dots between, we've got this asset of correspondence that's actually touching our members a dozen times a year. And we have an emerging audience that's saying that's an unbelievable marketing opportunity to help drive some of the engagement initiatives we're working on. So the confluence of all these people joining here is exactly what we would hope for. And we hope that everyone's able to get some out of this. So for those who have joined maybe some of our other webinars or even just directly on calls, I know I've spoken to some of you one-on-one. I'm Drew Corbett. I'm Clarity's Vice President of Product Innovation. I really come from a member and patient and consumer engagement background, all within the healthcare space. And so the lens that I look through Clarity's products through is really thinking about, have we done everything with the words on the page to help be resonant with that member, or to help that member take an action or a step that improves his or her own life, and also is a benefit to how they're using their benefits within the plan. So I'll be talking a little bit about that today, but this is really not meant to be an academic exercise. This is very day in the life. And so Sarah Riley, who leads our account management team, is also joining us today. I know Sarah's going to be able to bring a lot of great anecdotes from the many more discussions she's had with you through the past year or so. Sarah, I'll give you a chance to introduce yourself here too.
Yeah, thanks, Drew. And good afternoon, everyone. Thanks for carving out the time. Sarah Riley, Director of Account Management. I know I've met most of you on the call today, but for those of you who are new, looking forward to meeting you in the future. I oversee our account management team, so all of the account managers that work with you on a day-to-day basis, managing your print correspondence program. And what we're doing at Clarity is investing more time and not just focused on the production work, but also really learning and tailoring that experience to understand your engagement priorities. So as I'm coming here with Drew today, it's looking forward to opportunities in the next couple of weeks to meet with you and look at, for the full plan year, how are we looking at your member journey by different populations that you're communicating with, and maximizing the opportunities that you have through Clarity and the Clarity products.
Yep. Yep. And so why don't we establish a baseline, actually, because we know that this leveraging, let me say it this way. We know that pushing for engagement is something that every one of your health plans is working on. To a lesser degree, I think, people are really leaning on the correspondence opportunity that they have and pulling that into the engagement arena. So I'd like to get a baseline, and we've got a poll that we can put up here. It'd be helpful to know, and then we'll see the results of this a little later on, but where are people starting from? Is this brand new to your organization that you're starting to say, hey, if we send an EOB out, shouldn't there be some engagement language with that? Or is this something that you've got a pretty robust strategy around? So I think we can get a poll up here for people to see and participate in. So I'll just read it out loud for you. Are you currently leveraging your touch points, your correspondence touch points, with your members throughout the year to drive engagement? And that ranges from not at all, we'd like to, but haven't started, somewhat, or absolutely. And we'll give this, I don't know, 15 more seconds to run here. Okay, maybe let's take a quick look at those results if we've got them in. Okay, great. So I guess only 4 options there, but representing a little bit of a bell curve on definitely people who are doing this. I think a lot in that somewhat category is, that's near and dear to our hearts in the conversations we're having of, we know that we ought to, we would really like to, we need a little help getting over the hump of what that looks like and how we do that. And then of course, some people who this may really just be, this may be the dip of the toe today. So all great, this is really helpful, thank you. So Sarah, why don't I pass this over to you to just sort of frame a little bit about where we're at and some baseline engagement comments to set the stage here.
Perfect. Thank you. Well, as you mentioned, official welcome to the new year. We're very excited to be here. And over the last couple of months, we've spent most of our conversations planning your open enrollment season. We just wanted to quickly acknowledge, before getting into the engagement side, all the work that we received from you, our customers, as well as what it took on our side to put together a successful season. We know that during the time of this pandemic, it didn't come without its own unique challenges. We did experience things similar to you guys in terms of supply chain issues, as well as some labor constraints. But overall, we look at this season as a huge success. For us, it was really the largest amount of volume we've ever done. Most of that was due to the No Surprise Act. So in working with you and the plans to work on the reissue volume that came this year. And in total, we did over 44 million packages. So that was a big number for us. So overall, a huge success, and we couldn't have done it without you. So thanks. Jumping into engagement. So as Drew mentioned, why is Clarity, my printer, here talking about engagement? And really, as he mentioned, in looking and managing your print correspondence, we see a huge opportunity to test, learn, and optimize how we engage with your membership through that print channel. So call it ID card packages, member guides, EOBs. You already send this out to your members through the mail today. So why not maximize what and how you communicate with members through that existing channel? So we understand that most of you, as being risk managers, are paying attention to the costs associated with not engaging your membership and really are spending more time. Just as an example, the folks that are here on the phone today, many of you are spending most of your days thinking, how do I maximize engaging my members in their available resources? So we want to be right alongside you as you're planning out those priorities. And as we mentioned, for Clarity, we're in a unique position given our proximity, sort of this middle space to your members. So just last year, for example, we sent over 72 million ID cards alone. And we look at that as 72 million opportunities to have interactions with your members. We've also been investing in this area. So with Drew and myself, we both joined Clarity last year, and we've been hiring the team around us to support us with expertise and learnings that we share to you, and are planning to be providing opportunities where you guys can cross-share information in the future. And overall, we manage all this for you on your behalf. So because we administer the print correspondence, there's an opportunity for us to be testing and measuring what's effective and then continuing to optimize that over time.
Yeah, I mean, so just a quick comments there. So one of the things in my background, different organizations working directly in the engagement platform space, a question that we'd always have from our health plan clients was, okay, we've set up this great, say, web environment for people to go interact with, and now it's time to tell them about it. And we would say, okay, well, how does your email outreach list look? And typically we would see between 7 and 13% valid emails that they had on that membership. So it's not to diminish that email isn't a critical channel and it has to be pursued in its own right. But the strategic value of, again, adding a little bit of incremental support here to the engagement effort is with almost unanimity, we are able to reach someone through print. And to have that framework and that pipeline set up to all of your membership, again, it doesn't say, oh, well, now we don't have to do email anymore. Of course, that's a modality you should use. But where we really think there's an advantage is the Clarity plumbing is already set up. The correspondence is already going out. It's really just how hard are we leaning on it to add additional value. That's where we've started to get kind of excited. And just to echo your point on the 72 million ID cards here.
Yeah, good points. So let's talk a little bit about why effective communication is important. And again, for many of you on the phone, I'm sure you know and are thinking about this regularly. But in a study conducted by ID Power back in 2020, it was looking at what are the important things to include in that communication. They found that clear, helpful, and proactive information were really going to help increase customer satisfaction and then the customer's perspective of or perception of trust with that plan. So those three things, they measured performance indicators, the first one being clearly communicating to the member what and helping them understand their out-of-pocket costs, deductibles. I'm sure most of us would agree having information and transparency around costs and savings helps us plan and take action. The second piece that they found or measured was providing health education. We look at that often in terms of giving value back to your members, helping them learn or gain awareness. We often refer to that as reciprocity, so we'll allude to that a little bit later on. Again, helpful to be providing them with health education. And then the last thing was proactive information, and that's around providing useful reminders related to preventive-based services. So I'm sure all of us are very busy, and whenever we get the chance to receive a timely reminder, it's always really helpful. So also included in that study, and again, while these three things seem pretty straightforward, they also found that only 15% of Medicare Advantage plans were including all three of those components. So lots of room for upside and opportunity to be applying some of those clear, helpful, and proactive pieces. But they also captured consumers' perception that they saw the likelihood 3.3 times more likely to get helpful information from a bank over a health plan. So overall, lots of room for improvement for us. We just wanted to highlight as well, given the nature of the pandemic, sort of fractured communication, lots of information resources, it's really difficult to know where to start. So just to quickly highlight a little bit of the importance of that relationship, this was a study conducted by Forrester in 2021. It's looking at the longitudinal development of relationship and the perception of consumers with their health plan. So they were looking to measure more of that emotional affect, so a member feeling appreciated versus having negative association or frustration with that plan, and measuring the outcome of whether or not the member stayed with that plan. So as you'll see through this slide, there's some examples of positive attribution versus negative attribution that were then tied into positive effects. So when you help your members feel appreciated, they're more likely to stay with you. So 66% of those members were more likely to stay with that plan, and about 83% were more likely to renew. And then the inverse is also possible. If you cause frustration or negativity, those members are more likely to leave you. So I think we look at this as, I call it emotional equity. So wanting to build that over time, which doesn't take a while. So, and all in all, and what we're going to talk to you about today is starting that journey now and maximizing those various touch points throughout the year to build that appreciation, to build that relationship from the onset, and not just focus on that end of year open enrollment timeframe and that one touch point opportunity.
Yeah, another comment on this. I think this concept of, are we writing correspondence to make someone feel appreciated, or are we writing correspondence and they end up feeling frustrated? It can sort of feel like a little bit of a unicorn of like, where's the switch that I flick to make someone feel appreciated? So I think where clarity comes from is the idea that we need to start working out this muscle and start gathering data and start really understanding the tenets of, we believe that this is an element that maybe there's a barrier and we want to address that barrier. And Sarah's going to touch on that more later, but that will help lean the scales towards appreciation. And so this isn't a one and done. It's not saying, you know, if I'd had 30 more minutes, I could have written an appreciative letter rather than a frustrating one. But it is just saying that if we sit down with the intent to be appreciating who our members are and where they're at, we can start to identify data elements. We can start to look at trends of what's going on with different populations, and not fundamentally change those letters, but maybe just adjust the tone. So we've got a little bit more of that appreciation that's an empathy that's sort of baked in. So I think that that equity comment you made, Sarah, is right on the mark. But point here, this is a work in progress, not a you should be doing it and it's really easy. It's something we have to work at.
Yeah, so moving into what you just alluded to, Drew, some of the tenets of effective communication. So engagement, when we look at opportunities to optimize communication, we want to make sure that we're including some of these core pieces. And you will hear us talk a lot about these different areas. To what you just said about it takes time and it's sometimes a slow process. We do work overtime to develop all of these things integrated into one correspondence or the strategy of correspondence. So let's look at the ID card package for a second. If you were to consider tailoring that information for a new member based on their member status versus a renewing member, it would be like, welcome, Drew, to your new program versus welcome back. That type of messaging resonates with your membership. It makes them feel like you know them and understand what they're doing. Beyond that, we'd like to include additional demographic information. So we know that we get some of that information from you already in order to produce the card, So why not use some of that information to compile personalized information? Again, speaking to a millennial is going to be a very different tone or type of copy and interaction than speaking to a baby boomer, for example. So we want to be applying demographics and other ways to learn about that member so we can make it more personalized. Underlying all of those components are behavioral economics and behavior change theory. So we get really excited about this. These are all treatments that we look at applying in order to help motivate the members to take action as they receive that print correspondence. And we'll talk about that in a little bit. As we've highlighted already, it takes more than one time. So it's not really a one and done opportunity with anything. As Drew kind of walks you through the life or that member journey, you'll see we do think that multiple touch points are necessary in order to get a member to nudge in the right direction. So repetition is important. And then last, design matters. You know, we're passionate about print, how we print, what it looks like, but really comes down to, are you creating information that is engaging to that person? They're going to actually pick it up and read it and then digest that information quickly. So we spend a lot of time on how it looks, how it reads, and can that member read that quickly?
Yeah. And on that repetition, I mean, that just echoes the point of why are we having this conversation in January when oftentimes we're talking about our correspondence starting in July or August. Maybe this is a little bit far reaching, but if we're focused on, we want X amount of our population or X% of our population to perform an action, and let's say that that's register for our portal or download our app. If we're really starting the planning in August and executing the correspondence in in October, November, it's a little bit of a Hail Mary. And it's a different practice than running a playbook that says, how do we take every opportunity between January and December to try and institute those nudges along the way? And what we're seeing now that we're over a calendar year into this practice at Clarity is the repetition being applied. It's helping that percentage of people taking that action, registering for that portal every single time that we put a piece of correspondence out there. So just again, to echo, this is, it's a little more of a marathon than a sprint. The more we start to say the correspondence and the engagement are tied hand in hand. And that's how we want to support this.
So related to the tenants are some additional best practices. We spend a lot of time thinking about how you are segmenting and communicating to different populations. So what you see here over on the right-hand side are just some of the populations and audiences that we are starting to think about more readily as we look at certain groups and driving certain behaviors within those groups. So we know, for example, an achiever is going to need a different type of nudge than a distracted or disengaged member. I'll say overall with our experimentation, testing different opportunities, we are spending more time with the populations that are disengaged. As Drew highlighted earlier, print can have an unusual but also very impactful place for members that are not digitally engaged. So we want to be looking at different segments of your population, understanding how do we get them to go complete that one behavior, and understanding that they're going to come at it from different angles or different entry points. So when we're working with you, we really focus on the actions that you are trying to achieve. We then try to bring it down and isolate it into identifying that one thing that we can apply that will help move the needle with that group. And then from there, we're gaining more information about what actually works. So you'll hear us talk about these different cohorts and groups over time, but here's where we're spending a lot of our time learning.
Yeah, that disengaged and non-responsive. And Sarah, I know you've been close to some of the client discussions that have touched on this, but you just made the point on the last slide that design matters. And I think typically when we think about that, we're trending towards a more vibrant, colorful, sort of consumer-centric look and feel. When we think about non-responders, I mean, it's a reality that there are people in the world that only respond to the email when it's got a red exclamation on it.
Right.
And that's okay, because they are who they are. But in order to reach that person, we might actually be going the other way from design matters and that concept, and saying it's really the more somber final notice sort of a feel and language that's going to help that person get to that same goal. So different paths up the mountain, but I think it just speaks to meeting people where they are as much as anything, and sort of recognizing that at the outset of the process. But it's an interesting use case because I think as much as anyone that we hear about, Sarah, within a line of business, it is around, we cannot get X% to respond. And do we have new arrows in the quiver to help combat that? Not really yet, but that's kind of what we're working on.
Yeah, and definitely what relates to that is addressing barriers associated within those segments of the population. So when we are looking at print correspondence, for example, for a Medicare member, we do want to understand, what are those barriers that this group or this population goes through, and how do we help them overcome that, or offer an alternative to get them to, again, that endpoint behavior. So just for example, these are just some of the opportunities that we have to be promoting either alternatives or easier ways to get there. For example, if someone can't get to the clinic, can we offer them an Uber or a Lyft? For many of you, we've been having the conversation about in-home assessments as an alternative, and we know you guys are investing in that opportunity. And it's great because it helps those members stay within their home and still receive the information that they need. So we definitely want to be promoting those alternatives, and again, high value, high impact, and it removes some of the friction and the barriers.
Mm-hmm.
And you kind of alluded to this, Drew, in your last comment about behavior science. So this is where our team gets really excited. This is just the tip of the iceberg. Some of the statistics that you're seeing here are what we are learning through our A/B testing by applying different types of behavior science in different types of correspondence. So for example, in that authority bubble, that was a Medicare study where we found that if you included the source of credibility or a voice of authority, the Medicare population was 10 to 15% more likely to engage. And in our world for print, that's a lot. And most of these, they kind of seem low statistically, but these are significant compared to how you guys experience some of that engagement through print today. Another example was urgency. I know, Drew, we ran an experiment last year where we were looking at urgency language versus value-based language. And within the population segments, we found that that resonated with different groups. So as Drew mentioned, it's important to include either urgency-based language or value-based language, depending on who you're communicating to and with. So we get really excited about the learning, being able to measure the learning. So this is just an example of some of the behavior science that we're applying through our print correspondence, and then how we're measuring that in the after fact.
So I think that you just, you went across the word measuring that. And I think that's a really key part of this, because like when we look at, say, an ID card and a letter that it accompanies going out, oftentimes some of these principles might inadvertently be included in the copy of those letters. That's a really different thing than saying, we are going to try this letter out, leveraging the authority principle, and we're going to measure if that has a different echelon of performance. And if it does, that gives us a little bit of a green light to go further ahead with that in future use for that population or that audience. So we're not going really deep into it today, but I think you just even mentioning, Sarah, are you measuring the efficacy of these things, is a place that is really central to what we're trying to offer here. Is not just, can we dress a letter up, call it good because we instituted some of these behavioral principles, but can we go back and quantify that this one worked for Sarah and that one worked for Drew? And that just helps to sort of rise the tide of everything that we send thereafter. So I'm glad you hit on it.
Yep.
And I also think we're not going to do a really deep dive on different lines of business and markets, but we did just want to quickly show a few of the pieces by commercial, Medicare, Medicaid, and duals on we have to work within these realities of, there are some broad parameters of what's going on in the commercial audience. Now that doesn't get down to the individual level, but it helps to give us a starting point of what might the goals be that we focus on, and what might the tenets of value be when they come across as words on a page. And so thinking about commercial and if simplicity, if family-based language, we'll talk a little bit about that with some great data. Do those end up being more resonant versus with a Medicare audience? If we're talking about value if we're talking about authority, and then, no pun intended, just the clarity of that language there. As well as with Medicaid on access and convenience, and recognizing that the access point may be quite different. It's always the place to start. And so I guess I make this point to say it's not a one size fits all, because the news is different across these. Like when I think about the commercial population, and from your perspectives, the commercial line of business going into 2022, it's a different world than it's ever been before. So we're in the aftermath of No Surprise Act. We're managing a hyper competitive labor workforce challenges. And we've also got the Great Resignation that we're managing and dealing with. And so trying to talk to people through the lens of those realities are good ones to be mindful of, and just not trying to play with our back to the audience. I'm not going to go through all of these, but you can sort of pick and choose some of the comment blurbs and bubbles, but the attributes around a commercial audience are just ones that should be reflected on at the beginning of a conversation around what that correspondence might look like. And so the one I love is in this "did you know" bubble off to the left of the slide. You know, I think everyone in their own way, shape, or form is interested in cost and cost management. But it's what you append that cost discussion to that I think helps it to land or to sort of be noise. And so within the commercial population, that higher likelihood to be talking about families with children and recognizing is a letter that we're sending to a family with multiple dependents, and how we talk about cost in that context. That's a place that we might be able to be signal through the noise. So thinking about any of those elements is interesting within commercial. Similar in Medicaid and duals, you know, such a moving population, fairly highly regulated, also the most unique in terms of just state to state, how we look at and approach. But again, I'll go back to just access points being, I think, a foundational one to start with, and making sure that we're sort of aware of barriers, as Sarah referred to them earlier here. Or that we're as resonant as possible on what does this person's life really look like, such that I am promoting or asking them to take a step towards something that, sure, it's beneficial for us as a business and as a health plan, but you know, to just say it colloquially, this is like a low BS meter population. Like, if this is valuable to me, I will do it. If it's confusing or it's not valuable, I'm probably going to tune out. And maybe that least window of fluff around a group like this. So again, it's a regulated product, so you might not be able to do everything that you want to, but if we're leaning towards and bending towards that type of a psyche, we're seeing the data bear out that it can have a positive influence if we use the right behavioral principles. We did actually a deep dive on engaging Medicare in the context of the business of Medicare and star ratings, I believe in November. And so if that's a population you're really focused on, we can get you slides and materials from that discussion as well, and had a great partner that's worked a lot in the Medicare audience, firm we work with called Engages, support us on that as well. But you know, this I think is an interesting population because we can get really, really precise, similar to a HEDIS score over on the commercial side. But there are places, if we're looking at this with a fiscal responsibility to our health plan eye, there are measures that if we even move the needle by 1 or 2 percentage points, it can be the difference in being a 3-star plan or a 4-star plan or a 5-star plan. And so going in with that type of a context to, again, it may just be a letter that's carrying an ID card. This doesn't have to be a massive campaign around star ratings. But if that's one of the places that we're just alluding to, hey, grab that in-home assessment, because we at the health plan side know that the fall risk associated with an unassessed home is that much higher. It's one of those places where we're just meeting the barrier, and we're meeting the business, and we're meeting the member where they are. And we've found those to be, frankly, some of the probably most engaged conversations that we've had with clients over the course of 2021 is, where do we want those Medicare members to be 12 months from now? And how can we start to lay out what that happy path would be, and then help with every piece of correspondence to nudge them along it. I'm going to step back and one more time make the comment with that Clarity is a big believer in multimodality communication. So I keep saying meet them where they are is totally different than implying that correspondence is where everyone is. So it's the mix of, are you using and exploring text campaigns? Are you using email campaigns? What are the other methods of outreach? But within the correspondence vertical, there is a lot of work that we can get done that's a fairly low lift. And so it's really trying to operate at the top of our license just within that print piece.
Yeah, good call out.
Okay, so we promised that we would meet a member and kind of go through the thought experiment of what that member's year could look like based on leveraging a Clarity product suite that's a pretty foundational product suite, which I'll show you in just a second. And there are two, it's sort of a choose your own adventure. So in version 1, we're going to say that we run 22 just like we ran 2021, which is high quality, it's on time, it's all requisite communication gets out to the member, but not a whole lot else. It's fairly transactional. And then version 2 we want to look at is, what if we did test and learn? What if we did include some of these behavioral principles and philosophies into that exact same set of correspondence? Might we end up at a different place? Mm-hmm. The reason that we set this up this way is a fewfold. One is I really want to impress the point that driving more engagement doesn't mean, oh, last year we sent out maybe 6 pieces to Diane, and this year we need to send out 35 pieces to Diane. It's really about operating within what we've already got. And again, like I mentioned, the top of that license for every piece of correspondence. So this is not a pitch for more. This is a pitch for a different approach. So when we look at Diane here, our version on the left, we're achieving somewhat minimal engagement. And when you're seeing on this slide a CTA, and for those that aren't familiar with that acronym, it's a call to action. It's something that we as a health plan, if we walked into Diane on the street and we know that she has an opportunity to leverage benefits further and deeper, we would say, hey, I'm calling you to take this one action. And oftentimes that one action is establish your digital relationship with us. So get involved in our portal, because it's sort of the hub, and it's how you quarterback so many of your resources. This is something that we typically see health plans doing really well out of the gate, is an inclusion in some way, shape, or form of that first call to action. So an ID card might have a letter that says, here's your ID card. And also, we definitely encourage you to get involved in our online portal. As we go through Diane's year here, and we start going top to bottom on the left-hand side, we know that the next piece of correspondence that might come in is a 1095 for Diane. And then maybe a few EOBs just associated with due course of how her health year went. These oftentimes don't include that CTA again. And it's one of the places that we look at some low-hanging fruit when we compare this in just a moment. Oftentimes in the course of a year, we've also got Diane asking for a card reissue. Typically, that card reissue will go out with more or less the same letter. And so we're asking Diane again to participate in that call to action. It's fairly similar to the way that we had asked her the first time. So it's a nice repeat touch point, but doesn't altogether do anything new. This, when I go back to the, am I a frustrated member or am I an appreciated member? I think the argument that we're making is that you might end up with a little bit more of a either unengaged at best, or a member that's not totally feeling like you're in my corner. You're going to bat for me. This is just a little more transactional. It might be a little bit more on that frustrated side. So let's compare now to leveraging almost the exact same amount of paper and correspondence. And we're still starting at that same place. So January, February, we're looking at that ID card, and this is coming out of open enrollment, and that call to action is there. But what we might invite in this call to action is, well, what if we did a couple versions of that letter? And we send out one that is really colorful and another that uses value language and another that uses authority and maybe cites the AMA or something like that. Let's just see if we learn anything. And maybe the Dianes of the world respond better to one version or another. And that's a learning we can put in our back pocket for later. As we eventually get her to take that action, and we've made it really easy to address barriers, and she has now become active and registered on our portal, we can tee up the next call to action. And this is, I think, the beginning of the big conversation that we really want to invite is, it's all about next best action. How can we continue to help this person utilize more and more of her benefits? So in the case of a Medicare audience, we might know that Diane is a little bit behind on a breast cancer screening. And knowing that, Clarity can now include that message in a way that is sensitive and appropriate and compelling and all of those things on the correspondence thereafter. So 1095, I totally understand that's a product that's highly regulated. I think an argument to be made that we could use an address sheet in creative ways, but that's a piece that's going out. And then the EOBs are, we feel, hugely underutilized opportunities. Again, and I'll show some examples of the EOB, but in the Medicare space that may be more regulated, but we would push and encourage to say there might be a little bit of space where we can at least tap on the shoulder and have that additional touch point and include that repetition that Sarah moved to earlier. As we eventually hit that call to action, our fictitious health plan that we were thinking through this really values in-home assessments. And we've got maybe a great third-party partner that's administering those, and we've made a big investment in them. So we want to get the most out of in-home assessments this year. This might involve us moving that call to action onto, hey, we're thrilled you're online. Glad we're up to date with all screenings, and now looking at in-home assessments as being the next action that we want to take on. You're getting the rhythm of this. I'm going to move on to looking at some of the actual assets so you can see what version number 1 versus version number 2 look like. But strategically mapping, where do we want our footprint to be and where do we want our members to have demonstrably engaged this year? I think that's the conversation that we're trying to spark. So we mentioned, and a lot of you have been on the phone directly talking about and consulting with us on, we've always had this letter, we think it's sufficient, but we don't know that it absolutely rocks yet. And so this is a lot of what Clarity wants to bring to the table in terms of, is there any reason that you wouldn't put the letter at the forefront out there in the mix and maybe just send that to 1,000 people and see if their response is different than 1,000 people who receive the one at the back? And it starts to inform us on which behavioral principles have really been effective versus which ones kind of don't land. It's not to say that one of these letters is the be all end all. It is to say that we are now starting to try and learn what makes people feel appreciated and wanting to engage. EOBs, I mentioned the same. Now, the interesting thing about EOBs, I think, they're so relevant to a condition and probably a time in that person's life when they have heightened attention to that condition. And in that sense, we've got an interesting opportunity to present a resource that's related to quality of life around that condition. So very standard documents, again, within the Medicare space. If I were looking across the commercial space, I think we'd argue that the EOB is ripe for a little bit of design work as a general industry statement to say, can we make this more intuitive? Can we make it a little more friendly? Again, within those regulated audiences, we always have that opportunity at the bottom of an address sheet to put in that little bit of engagement communication and show that we care beyond kind of the rows and columns that are required in the rest of the document here.
I'll just add,
yeah,
sorry.
Go ahead, Sarah.
From a frequency perspective, again, for most of our EOB customers, you will be hearing us talk about this. Really, that welcome letter, to your point, Drew, in the earlier slide, is maybe 1, maybe 2 opportunities a year to maximize that, whereas the EOBs themselves go out frequently. So opportunity to test and learn and iterate throughout the year, not just on the very few and rarer times.
Yeah, if we're going to hit repetition, this is the easiest place to go lean. Audience dependent a little bit, but definitely the easiest place to go lean. That said, though, and this is the one place that I'm straying from my, is it a different set of communication than it was last year? This may be on brand for you and it may not be, and that's okay. So, I mean, we're bringing the idea that, is there any reason that we shouldn't be wishing a happy birthday to our member? And we're looking forward so much to the next 10 years with you. And hey, by the way, here are a couple of ways that we can make sure we're healthy getting into that next 10 years, and reinforce the call to action that way. I think overt appreciation could also be a happy anniversary. So one of the attributes of Diane here is that she was a commercial audience member, rolled into a Medicare product thereafter. And so having that continuity to say, we've had a journey of the last 9 years together. We wanted to say thank you. And we wanted to say, here's our few free things that you can do to get the most out of us so that we can keep supporting you. It is new. It is something that, like I said, it may be a hit or maybe totally DOA for you if we were to bring this up. I think what I'm trying to invite bigger picture is, let's allow ourselves to think outside of that box and be a little bit creative. And maybe there's a different opportunity that you could lean on, but we don't have to be limited. And that's one of the freeing things about correspondence starting to work its way into the engagement world, is we can have a more open conversation on what does correspondence look like now that engagement is part of our mission.
Yep. I'd love to get a birthday card from my health plan.
Yeah. And like one that, personalization doesn't just say, "Dear Sarah."
Totally.
It says, X, Y, and Z that we know that can help you. So, so this is the recap, and we'll be brief on this one. But if I were putting my marketing hat on, as I know a lot of the audience members are today, and I were to say to that marketing person, hey, you're charged with getting people to accomplish these calls to action. What if I gave you 10 additional touch points throughout the year to help achieve those calls to action? From a marketing perspective, it's an unbelievable level of access that we have sitting there within the Clarity product suite. And so the invitation is to lean on that product suite to say, it's gotta be leaning us into the engagement world. Otherwise, we're just underclubbing what the value of that is. Any other thoughts or comments on this one, Sarah?
No, I think you did a good summary.
So
I'm just doing a quick time check too. I know we wanted to get to some questions.
Yeah, we've got some questions. I think my maybe parting comment on that is, again, we are right here at the top of January. And that's why we're excited about the conversation here, and why really our sort of call to action to this group is, let's just talk about what this might mean to you, and what's possible this year and what's not. Again, another reason that we laid out a calendar this way is, if you're looking at this saying, I need more work, like, I need a kick in the butt, that is not what we're going for on this. The purpose is to say the correspondence volume is probably ample already. But what Clarity is now able to introduce into that correspondence volume is higher value. So this isn't a boatload of new work, is the takeaway. I don't know if we did have some questions come up here. Sarah, I don't know if you've been able to see any, if they came in. Some of these we may be answering offline and getting back to people, but happy to look at some if there are.
Yeah, I did see a good one that was brought up around the impact on CAP scores. And do we have any data around member engagement? I was wondering if you could just speak to how we're thinking through CAP's opportunities and planning.
Yeah. So I mentioned star ratings a little bit, just because we happen to go into that on the Medicare audience. But basically, from a reimbursement perspective, if we've got these structures that outline where value lies, CAPS, of course, being another instance similar to star, it's a really good starting point for the conversation, because different health plans might have a different place within the domains of CAPS or star ratings that they're really looking at. Similar to the value tenets within an ACO, you and your leadership and your organization might really be responding to, I want to move the needle on this particular score or this particular measure. I loosely referred to a lot of health plans are having strategic partnerships with a startup, a really exciting company, someone that's doing your in-home assessments for you or whatever. Those are often partnerships that are born out of, we have to move the needle on this star rating or CAP score. Those become really good fuel for an engagement conversation and what gets included in that population's correspondence. So without going directly into any one of them, if we're having the follow-up conversation on that and those are relevant tenets of what's valuable to your health plan, then it's great fodder for the beginning of the discussion.
Awesome. Another question came up that I thought was helpful is, are you able to segment our members for us based on our current data? And I'll answer a little bit of that first, and then you can add to it, Drew. So overall, I would say that we've been working with plans over the last year. For some plans, it's easier to get data than others. So we do spend a lot of time in the planning of the correspondence opportunities, understanding what data we have available. So usually we take the population file that you are sending us already for the print correspondence, look at ways to segment groups based on that information. But just for example, this morning I had a call with a client who is interested in segmenting letters based on member status. So they're going to be sending us some new information to be able to identify a new member versus a renewing member that allows us to then publish different versions of letters for those groups. So we do spend a lot of time talking about data. We didn't even go there today, but that's part of the work that you get from my team, as well as working directly with folks on Drew's team to really understand your data challenges and limitations, and then work within those opportunities to say, well, we can try this, or for next year, let's kind of work towards that other data solution. And then on the back end, for getting information about the correspondence, as we alluded to earlier, we do work with you to retain information about programs that are outside of our realm. So we want to understand, did a member register when they received that information from that correspondence? So we work with you on options for that as well. And then we pull that into a data dashboard where we're showing you different metrics and segments of your population and that interaction history. So a lot more to talk about when it comes to data, one, receiving it upfront, and then also downstream, how we measure what correspondence is impactful for you and how to give you those insights.
Yeah, it's a good follow-up as people are thinking about where to go with this. If the analytics and the quantification of, hey, how does this work? How do we measure it? How do we prove what's working and what's not? Would love to show people what the analytics dashboard around these products look like. That's a place where we're pretty excited also. Just a kind of closing comment for me. I would guess if you're like most organizations, January is a time where there are a lot of town halls happening and a lot of executive leadership. This is where we want to go this year. And I suppose the invitation would be listen to those high level objectives of your organization through the lens of, I bet I can actually nudge some of those with what I'm already doing on the correspondence side by introducing some of these things. It's a helpful way to connect how much value you can get out of this. So with that, I know, Sarah, you and your team are thrilled to be having conversations as a follow-up to help people maybe beachhead into some of this stuff, try out some new principles, try out an experiment. I think that's where we hope to go with this. And I don't know if there are other closing comments. Like I said, we're going to get everyone the recording as well as the slides on this. I know there were some other requests for the Medicare presentation that we've done as well. So I think we can probably include that too, but if not, just reach out to us.
Yeah, we'll make sure we follow up on all the questions provided. Thank you. And then, yes, to your point, as you are in those town halls and meetings, we do want to talk about that with you. So I'm sure you'll be hearing from your account manager and the account team regarding those discussions and really setting a plan for the new year. I know this month is going to go by quickly, and you're still in the middle of open enrollment, but we really look at the key opportunity testing timeframe between March and August. So we kind of want to stay clear of your open enrollment planning and really give you some good insights to be applying into next year's open enrollment. So I think that's it.
Good. Well, how about 5 minutes back on a Wednesday? We really appreciate everyone coming. we're excited about this content. We've got some other webinars teed up that really spin the gamut of different types of content on what's going on in the personalization world these days, on some of the other opportunities out there. So stay tuned. Always come back if you like, and we'll hope to talk to you next time.